I'm Dr. Sherry Brown. I am here with Dr. Sheila Sahni, one of ACC's emerging advocates. Welcome to Fits on the Go.
Thank you. Thanks for having me.
It's our pleasure, Dr. Sahni. Tell us your thoughts on how FITS can engage in advocacy on social media.
You know, social media is probably the best place for FITS to engage in advocacy. And that's because we're kind of the media generation. We're used to being on our phones probably more than the higher-ups. And what you can do is when you start to go to conferences, you can immediately start to engage in the conference, in the dialogue of what you're learning. You can do that as simply as starting to take pictures. When you start taking pictures, you can tag them and add something very quick about what you're learning. And you can tag the conference hashtag. When you use a hashtag, it links to a database. And that database basically generates a lot of social traffic. And so you can start to send a message out about what you're learning or what you're interested in, what you really care about. And that's really how FITS can engage, because we're constantly getting grants to go to conferences. And we can travel for free. And it's a very great thing to take advantage of, is to use your time at that conference to start to create your own personal social message. In terms of advocacy, you can start to develop now a professional platform. So let's say you were a heart failure fellow and you were going to a heart failure conference. Now you're engaging in that heart failure community. When you come back to your day-to-day clinic, you can start to read articles about heart failure, and you're generating that buzz. You're creating a social message about that area of cardiology that you're interested in. And at the same time, it can be something regarding prevention. And that's a great way that you can advocate for your patients. So social media can be used as specific or as broad as you want. And you can keep it centered on patients by, having an overall message for advocacy. And you can also focus within your small subspecialty of cardiology. And you can create conversations by using Twitter handles and linking to hashtags.
That was a great overview. Hopefully some of our FITS will take this as a catalyst to become more involved in social media for ACC, for advocacy, and for our patients.
Absolutely. Thanks for having me.
And thanks for joining us. For more videos, visit youtube.com/FITSontheGo.